I'd like to call to order the regular meeting of the New Canaan Board of Education for Monday, December 15th, 2025. We're going to start by saying the Pledge of Allegiance. Thank you. First, we're going to review and approve the agenda for December 15, 2025. Can I get a motion to approve? Hugo, second. Brendan, all in favor? Thank you. Unanimous. And then we're going to approve the minutes from December 1st, 2025, our last meeting. Can I get a motion? Matt, second. Kate, all in favor? Unanimous. And lastly, we're going to approve the minutes from December 8th, our budget workshop. Can I get a motion? Josh, second. Brendan, all in favor? It's unanimous. Yeah, you were resting like this, so you were sort of in favor. Okay, comments from the public. To ensure the public's right to be heard, the board has set aside time during the meeting for public comments. 2 minutes will be allotted to each speaker and a maximum of 15 minutes to each subject. Is there anyone who'd like to approach the board? Seeing no one, we're going to move on. First item is the board vacancy appointment, and I'm going to speak for a couple of minutes, so just bear with me on that. At our last meeting on Monday, December 1st, I announced the Board of Ed vacancy to New Canaan residents and asked for indications of interest. Fortunately, we received several, and we thank everyone who threw their hat in the ring and hope they feel like their candidacies were given the attention they deserved. Our 2-week process was a thoughtful and thorough one. Every board member was an active participant, and the process involved countless meetings and phone calls. It culminated in parallel caucuses over the weekend, after which we came together and collaboratively decided who we thought the best candidate for the vacancy was. I want to thank my fellow board members for their time, energy, and thoughts. I think we're a better and more cohesive board having gone through this process the way we did. With that said, one candidate differentiated herself and proved to be the best fit for the board at this time, and that candidate is Dr. Raquel Harrison. Raquel is the daughter of Cuban refugees and has lived in New Canaan for nearly 12 years. She and her husband Scott have 3 children in the schools, 2 daughters at Saks, Hannah and Sarah, and another daughter at South, Maddie. Raquel attended the University of Notre Dame as an undergraduate and went to Cornell for medical school. She did her residency at New York Presbyterian Hospital and spent 5 years as an assistant professor at the Yale School of Medicine. A former emergency room physician in Bridgeport, Raquel has served on the Health and Human Services Commission the last 2 years. She's a co-founder of New Canaan Unplugged, a group that helps parents and families navigate the ubiquity of modern-day technology, and she's a frequent lecturer in lifestyle medicine at the library and for New Canaan Cares. Raquel is also the former head JV girls basketball coach at New Canaan High School, a former assistant coach for the girls varsity team, and a volunteer with Young Life, a faith-based group that helps kids find a sense of belonging. If you'd like me to go on, I can, but I'll leave you with this. I've asked around, and everything Raquel gets involved in, she seems to make better. Her even-keeled temperament, evidence-based approach, and positive can-do attitude are exactly the types of traits this board needs right now. I'm delighted and honored to bring her appointment for consideration to this board. Needless to say, I support it enthusiastically and unequivocally. So at this time, I'd like to make a motion to approve Dr. Raquel Harrison as a new Board of Education member to serve out the expired term of Matt Campbell, who resigned from the Board of Education on Monday, November 24th, 2025. Can I get a motion to approve? Hugo. Second. Erica.
I would also just like to add that I have been really impressed with the strong positive feedback that we've heard across the board from community members in town about their experience working with Raquel on both the Health and Human Services Commission and Unplugged. She is thoughtful, she is collaborative, and she is an excellent communicator. She has already demonstrated deep commitment to New Canaan, and I look forward, along with others, to having her expertise and insight on the Board of Ed.
Okay, with that, we're going to take a vote on Dr. Harrison's appointment. All those in favor? All those opposed? It's unanimous. Congratulations, Dr. Harrison. Welcome to the Board of Ed.
Next meeting, nameplate.
On to the next phase of our meeting now, the reports section, and we're going to start with an insurance update from our benefits consultant, Mr. Joe Spurgeon.
Hello. Can we get that projected?
It's my pleasure to introduce Joe Spurgeon to the board. Some of you know him, others are about to get to know him. Joe has been working with our Board of Education for a good couple of years now, and nobody knows the intricacies of insurance for boards of ed or municipalities better than Joe. His expertise has helped us through the years to plan, to be prepared, and to come out ahead as often as possible in a very, very challenging environment. So thank you, Joe, for joining us tonight and for running through some of the ins and outs as we prepare for our 26-27 budget.
Great. Thank you. Thank you for having me. So it's nice to see some familiar faces. Every year about this time, I think I come and do this initial budget projection. Just so you know, we started the projection actually last month. We've already updated it once. We'll keep updating the health insurance budget throughout the budget cycle. So really through April, when we have March claims, is typically when we stop. But if we have to go further, we can. I'm going to walk through a little bit. I know a lot of you already know this, but I'll talk a little bit about your plan and how it's funded, your self-funded plan. So we'll talk a little bit about that before I get into any of the numbers. Feel free to ask questions as I go along. If I'm going too slow, Mr. Chairman, just tell me to speed up. I tend to talk long, right? But anyway, so New Canaan is a self-funded group. What that means is you're liable for all the claims that are incurred by your employees and retirees that are on the plan. We do use Cigna as our third-party administrator, but all Cigna really does for us is provide access to the network. They run our customer service, they build our benefits, and adjudicate claims. When any New Canaan member incurs a claim, Cigna processes that claim, but they actually pull the payment from New Canaan's bank account and pay the providers directly. So you are fully liable for claims that are incurred against the plan. That's as opposed to a fully insured group or a premium-based plan where you pay Cigna or Anthem a premium and they're liable for your claims. What's important to understand about being a self-funded group is beyond just budgeting for the cost of healthcare every year, you also have a responsibility to maintain reserves. And in New Canaan, you guys have some rules about how you maintain your reserves. You're responsible for a portion of your reserves, and the town is responsible for a portion of your reserves, and happy to talk more about that if we need to. The reason why you want to have reserves is, while I like to say we're pretty good at projecting claims, no one is ever 100% accurate. So you have to be prepared that claims could be higher than expected. They can also be lower than expected, but claims could be higher than expected. So you have to have a reserve account to be able to draw to protect you against claims when they're higher than what the budget may have been accounted for. We do have some stop-loss protection. What stop-loss protection does is that protects us from what we call catastrophic claims. We have two types of stop-loss here in New Canaan. We have an individual stop-loss and an aggregate stop-loss. Individual stop-loss is what it sounds like. It's a stop-loss policy that applies to any member on the plan, right? So an employee, an employee's dependent, everybody has their own individual stop-loss. In New Canaan, that's a high level. It's at $300,000. So if any one member incurs claims of $300,000, once we hit $300,000, that claim goes to the stop-loss vendor. You're only responsible up to $300,000. We pay premium for that. That's a big part of our budget projection, so we'll talk a little bit about that when we get into the budget projection. We do pay a premium to have stop-loss insurance, and we'll talk more about that. You also have aggregate stop-loss insurance, and what aggregate stop-loss insurance does, it protects the whole, right? So if we say claims are going to be $10 million, they're more than that, I'm just using easy math. You have 120% stop-loss. That means you're liable for all claims up to $12 million, right? Up to 20% over the budgeted amount. Once we go over that amount, then the stop-loss vendor becomes liable for those claims. That's an important component for you, the Board of Ed, because there are some liabilities, and I'm sure you guys have talked, many of you have talked about this. Board members do have some fiscal responsibility and liabilities on the actual budget for the health plan. So in New Canaan, we've always been very cognizant of aggregate stop loss. It's very important when we work with the stop loss vendor that if I think claims are going to be 17 million, they're not saying claims are going to be 20 million, right? We want them to be as close to my projection and as close to your budget as possible. But those are the two types of stop loss insurance that you have. And again, we'll go over that when we get into the projection. One of the things that I do lots of things for the board. Probably this time of year, most of what we're doing is budget projections and tracking of claims. But I also assist you guys in negotiations when you're negotiating with the unions on should we make any tweaks to the benefit plan. We do all your compliance issues. There's lots of compliance issues these days. We handle all your compliance issues. And then day-to-day issues that might develop if an employee is having a hard time getting a claim paid or having issues with Cigna, we get involved in that as well. Any overall questions? All right, so what I'm gonna do first is review claims. You'll have a color-coded, you should have a full document, a full packet for me, and the first page is color-coded. I'll explain why yours is color-coded in just a second. These are what we call your net paid claims. And so what we do is you track those by month. We go back on this report up to the 2020-2021 fiscal year, and we track that by month. On this report, I'm showing you net paid claims. And what that means is if somebody was over stop loss, in this number, you're only seeing their claim up to $300,000. It doesn't include any claims over the $300,000. On the next page, I'll talk about gross claims, and you'll see how much I'm backing out because of those claimants that are over $300,000. So this just tracks net paid claims. And we track it by month. As we come through the projections. The reason why I have those color-coded is your plan year actually runs consistent with your school year because that's consistent with your collective bargaining agreements. So your plan year runs September through August. Right now, we're talking about a budget cycle that's fiscal year based. So your budget cycle is July through June. And so a lot of times when I was doing this presentation before, I'm talking about one set of numbers, and Joanne prior to Sean, I was talking about a different set of numbers. So what I did is I color-coded here. So if you look in the first column, the blue shaded rows are the plan year, which would, are part of the fiscal year. So better way to look at that, sorry. The brown column, right, July and August, in 2020 to 2021, and if you look in the column next to it, continues through June, that's your actual fiscal year. And if you look down below, scroll down a little bit here, you can see I sum up both your plan year, so I'll go back again to the second column. So for plan year 21-22, you had $13.8 million in net paid claims. That averaged out to be $1,147,000 per month. But over that fiscal year, right, the brown columns, it was $14.2 million, or about $1.2 million on average. Probably most of the numbers that you guys see are the fiscal year numbers, not the plan year numbers. But when I'm doing projections, I'm trying to project for the plan year. So it's important for me to track it on a plan year basis as well. Any questions on that? So what you can see is we draw our claims, net paid claims for a month. So you can see from 2021 through the most completed year, 24-25, we went from $13.3 million to $17.7 million in the final 24-25 most completed year. Our average in 2021 was $1.1 million a month. We've increased that to about $1.5 million a month. So that has grown a lot. Fairly consistent with trend. I'll talk more about trends when we get to the budget projection. But you can see that this is a big number as part of your budget, and it's a big growth number. And we'll talk more about that again, too, when we get to the budget projection as well. Just and the next page is a little bit better because I show you how you did versus projected. But just a couple observations about this current year. You can probably see a little bit. It's kind of hard to tell, but we're really off to a good start. What I would immediately show you is if you look at the first 3 months, November was the first month over $1 million. If you look at the 2 prior years, all 3 months were already over $1 million. So we're off to a good start this year, which I'm happy to see. Just some quick notes. November, which was the high month, was about 4% over October, but it's 15% lower than the prior November. November was about 4% higher than the average prior to that. So if you look at just the first 2 months, our average kicked up, our November was about 4% higher than the average. And if you look at the full plan year to date, right, so the first 3 months, we're about 14% lower this fiscal year, this plan year versus last year. So we're off to a really good start. I'd like to see that. Again, when we talk about the projection, we're really early on in the year. So when I do projections, I'll jump ahead a little bit. When I do projections, I'm always looking at the most recent 12 months of claims. So we're not just using this plan year's worth of claims or this fiscal year worth of claims. We look at the most recent 12 months. And so one thing to look at when you look at this sheet is you can generally tell, and it's not exactly, but when I update with claims through December, what will happen is December of 24 is going to pop off. And if you look, December of 24 was a high month, right? 1.6 million. So one way to think about that is if December 25 comes in at 1.6 or lower, then we'll see an improvement in the projection that I'm going to talk about at the end. Okay? So as the board's looking at these, I don't know how often you see these claim runs, but as you look at these, that's a kind of a quick way to say, hey, how are we running, is kind of compare the prior month, the prior year's month, and then look at what's upcoming. If that number is higher, if claims come in at 1.7, then we're likely the projection won't improve. And then just because, while we're on that, if the projection doesn't change much, you probably don't change your budget, right? We're not trying to hit it exactly on throughout the year. Once it's in your budget, it's kind of easier for you guys to work around a number. But if it gets significantly better or unfortunately gets worse, then we can make adjustments throughout the cycle. There's some more data at the bottom. I won't go through all of that. Just some terms that are important. We have average contracts and average members. A contract is the employee or the retiree that you provide coverage to. It's not your total number of employees, because not all of your employees take your insurance. So it's saying that 625 of your employees or your retirees are enrolled in the plan. A member is that employee and their dependents. So, for example, I'm a family of 4. I would represent 1 contract, but I'd represent 4 members. Okay? You can see that your average enrollment dropped in that, was it 22, 23 year, and it stayed kind of consistent. So we were a little higher in the first 2 reported periods, and then we dropped down to in the 620s. Instead, stayed pretty consistent on that. The boxes below there, we do an average cost per contract and an average cost per member. The yellow column is annualized. It doesn't mean a whole lot now, right? A lot of claims are going to develop throughout the year. So those average costs per contract and average cost per member will change throughout the year. Although I will say I'm happy to see it's running 34% better, right? That is a good sign that we're running better than the prior year. But just understand that's not a complete year, right? It's a pretty immature year. I like this document a little bit better for this type of meeting. Here what we do is we track kind of 2 important pieces. We're tracking how did we do versus projection, and then we're also tracking our high dollar claimants. And tracking high dollar claimants is important. The vast majority of the change in your costs is going to be related to the number of high dollar claimants that you have. And that's becoming more and more the case, not just in New Canaan, but everywhere. It's also an important factor because it influences our stop-loss rates. And stop-loss rates have gotten pretty substantial, which we'll see when we get into the projection in a little bit. So what we do here is we track our expected paid claims. So every year I sit down, this says Cigna. A lot of times we're using the projections that Sean, Brian, and I kind of review. We come up with an expected paid claim number. You'll see how I do that in a second. And then we're kind of comparing how we're doing against that. So you can see in the second to last column for 2024, we expected claims to come in at $17.3 million. Our gross claims, so here I am counting all the claims, even those that are over stop loss, came in at almost $18.5 million. Of that, $818,000 was for excess claims, so those were claims over stop loss. So our net claims is at $17,654,000. So what you can see is we were at $358,000, or about 2% over expected in that year. If you look back historically, 23, 24, we were over by almost, well, a little more than 6.5%, or almost $1 million. And then we've been kind of about 2 to 3% over, except that first year we were 0.72% over. One note on the first column, that was our kind of post-COVID year. Dr. Harrison might be able to chime in on some of this as well. We saw in really April through June of 20, basically the healthcare system, elective procedures basically shut down. And we saw that in your claims, right? People weren't going to the doctor, so you guys weren't paying those claims. We kind of had a COVID hangover in the healthcare system for at least a year, if not more. You guys kind of jumped back a little quicker. But people were still just not anxious to go out into the healthcare market. So we did see some reduced services in that 2021 cycle. We were pretty close to expected. I think if we went out to probably 4 or 5 columns before that, we were under expected probably as often as we're over expected. So in general, we're probably averaging out pretty close to expected over the cycle. So if you look year to date in the last column, just to explain this number a little bit, for the finance guys in the room, you're not going to like this. The 18.2 is our projection in claims for this year. The 4.54 is just a de-annualized number, right? So I take the 18.1, divide it by 12, and then multiply it by the 3 months of the plan year. It's not a real accurate way to do it. What we really expect to happen is in the first part of the year, people haven't hit their deductibles yet, right? So the plan's not paying those claims. It's really hard to adjust a seasonality adjustment to it because stop-loss claims can kind of throw that off as well. So what I always tell my clients is this is just kind of a litmus test, right? If it were a straight annualized number, then year to date we should be at $4.5 million. Gross claims came in at 2.9. We're running $1.7 million under expected, or about 36%. We're not going to end that good, but what I will say early on in the year, that's still a really good position to be in. And my next page will kind of talk a little bit more about that. So the line below that, we talk about individual stop-loss premiums. You can see that it has risen quite a bit. Almost doubled, a little more than doubled actually from 2021. So we were at 783 in 2021, and then we're at 1.6 million projected for the 25-26 cycle. We do share stop loss with the town, we're kind of pool rated, but we still get individual adjustments based on how we're doing. I would say that I'm optimistic that we should be able to see some if claims stay the way they are, we should be able to see some improvement in our stop loss number, right? Listen, I understand the stop loss companies need to make money, but they've made more money than I think they need to the last few years on New Canaan. So we'll be working with stop loss carriers as we go out throughout the projection. One problem with stop loss is we really can't lock stop loss in until the stop loss vendor sees March claims. Your budget's already done by then. So I'll be working with Sean and Brian kind of as the year goes on the stop loss projection. Again, we'll talk more about that in a second. Just one note, we do not use Cigna for our stop loss vendor. We can, we don't. In the past, on this report, we've used Voya for the first 4 cycles, and then we moved over to Sun Life the last 2 years. Stop loss is a real easy plan to change because it does not impact employees at all. Right? If we change from Cigna to Anthem, we have to worry about doctor disruption and other factors. How does Cigna count visits versus Anthem? When we're talking about stop loss, that does not impact members whatsoever, right? So there's no impact to members, and we've been really aggressive at shopping stop loss. Actually, I think the year before, might have been 2 years before, we were Sun Life before. So we were Sun Life, then Voya, and then back to Sun Life. The next section is where we start talking about catastrophic claimants or high dollar claimants. Here we define a high dollar claimant as any claimant over $50,000. And that's just medical and drug. I don't really care about dental in that number. But so anybody over $50,000, we're going to count as a high dollar claimant. And so what you can see here, if you look, let's look at the second from the last column. Of our 17,654,000, 7.7 of that was tied to our high dollar claimants. The remaining 9.9 was for our non-high dollar claimants. On average, we had just under 1,500 members, right? 1,486 members. 63 of them were high dollar claimants. So what this shows you is 4.24% of your enrollment was driving 43.39% of your costs. That's pretty consistent with what we're seeing in the market. It's increased. If you look at the first couple of columns, if you would have asked me back then, I would say, yeah, it should be around 3% and in the 30s. Now we're seeing anywhere from 3.5% to 4.5% and into the 40s. I'll jump ahead a little bit before we get to trends. What I believe is going on, it's really hard to get some of the data from the carriers, but what I believe going on here is this is a cost issue on the, not so much the drug side, but really on the medical side, and likely mostly tied to hospital claims. So we're seeing more high dollar claimants. I don't think that's a function necessarily, while it is the case, would be true as well, but I think it's less a function of more people getting sick and becoming a $50,000 claimant, as opposed to people who were $35,000 claimants are now just as sick as they were before, but they're now $50,000 claimants. And that's a kind of a function that we're seeing across all of the nation. Really, it's a national issue that we're seeing is an increase just in hospital cost. In fact, when we get to trends, I was sharing earlier, for the first time in about 7 years, medical trends are higher than drug trends. Drug trends have really been driving trend lately. This is the first year where I'm seeing medical trends higher than drug trends. And I'll talk a little bit more about that when we get into the projection. And then down below, I won't go line by line because you don't want to listen to all that, but all I do is just bucket by dollars. Those are the large claimants, just bucketed by dollars. You can see last year our highest claimant was 781,000. If you want to understand the impact of some large claimants, you can see the first two columns. We had a $1.8 million claimant, a $2.1 million claimant, and a $1.3 million claimant after that. The year before, we had a $3 million claimant. So it's not unheard of to have $1 million plus claimants anymore, which is, when we talk about stop loss, which is one of the factors driving stop loss cost. This sheet I like even better. What this does is it basically takes the sheet we were just looking at, the page we were just looking at, and it just says, hey, what if all those years were November, right? So it just gives you a better base of comparison. I won't go line by line, but what you can see is that, kind of to my earlier statement, every year, right, we are running better than projected at this point in the year. So we expect that we're going to run better than projected early on in the year. Last year's a good example. I mean, we were at 22% under expected. I would have probably told you back then, hey, we're looking really good this year. We end up being a little bit over expected, right? So it's hard for us to really predict the full year, especially this early on. And then you can just see below, I think if we go to the section 2, if you look at the members and the members and the dollar amounts, right? This current year, 0.27% of our enrollment's driving 12.24% of costs. Last year was 0.54, driving about 25% of our costs. And the year before, 0.8, so almost 1%, driving 38% of our costs. So I think this sheet helps us kind of understand how we're running. And I do think we're running, pretty good given where we are early in the year. Questions on that? All right. So projection. The way we do projections, as I said before, we're always going to look at the most recent 12 months of claims. The first column on this sheet is the current in-force budget year. All right, so that column, if you ask me to come back in 3 months, that column's not going to change, right, because that's our current budget year. As I said before, we update the projections every month, but it never changed significantly enough to not use your initial budget period, which was based off of October, right? So we might find that, hey, we just keep using November for the rest of this budget cycle too, unless things change significant enough that you'd want to make an adjustment to your budget. This is kind of broken up into really, most of the magic's happening in box 2 and box 3. Box 1 and box 3. Box 2 is just informational and it's data used somewhere else, and I'll talk about it. But really, box 1 and box 3 are kind of the important piece. That's where we're building the expected claims. So what I'll do is I'll walk through the second column and just kind of compare it to the first. The first number that you see in the second column, actually I should say, the first line you see is November 25. So I'm looking at the 12 months through November. That'll be important when we get to box 3. Compared to last year, it was the 12 months through October. You can see that claims, gross paid claims came in at $18,986,000. By the way, that's not going to track back to my claim reports, right? Because it's a different 12-month period of time. So that number's never going to tie back to my claim reports. So we're at just under $18 million. Normalization adjustment, it's a 1, so we're not adjusting anything. We put that in for COVID. During the COVID years, we knew claims were understated because people weren't going out for services, so we made adjustments. I believe we were using about 3.5 to 4.5% here. We based it on actual known factors in the past and then projected forward. I just kept it on here. People still ask me, do we have to worry about COVID? Not this year as much, but last year I still had a lot of questions on it. But no, we're not making any adjustments for COVID in the base year or in the projected year. So the next line is important. You'll see I'm backing out, it's a negative, right? Almost $3 million, $2.9 million. What that is I'm backing out the entire total claims for anybody that went over $300,000. So if Joe has $305,000 in claims, I'm backing out $305,000. If Brian has $525,000 in claims, I'm backing out all $525,000 in claims, okay? We're not going to avoid those claims. I'm going to add them back, but I'm only going to add them back at $300,000, and I'm going to do that in box 3. So I'm going to back out all my claims that were over the stop loss attachment point, and to that, actually, we would actually back that up a little bit even more and say, well, if we have trend, if I only back out at $300,000, right, I'm going to trend that person forward into the cycle, so it's just easier to back the entire claim out, right? Some underwriters would just back out anything over 300. So in my example before, if I was 305,000, they'd only back out 5,000. The problem is I'm still trending $300,000 forward, right? If it's in a 10% trend, I'm trending $30,000 forward. I don't want to do that. So I back out the entire claim. So I get an adjusted paid claims. If there's a benefit adjustment, here what we would do is if there were any significant changes in the benefit plan, if, for example, the teachers doubled their deductible, right? They went from their $2,250 to a $4,500 deductible, then we would make an adjustment, right? Because the claims are based on the $2,250, so we're going to adjust those claims. There's no reason to make any benefit adjustments. You guys are all in the same plan, by the way. Here at New Canaan, all your employees now have this, all the unions have the same exact plan. I then bring in my experience period contracts, and that number looks pretty big, 7,530. That's not that you have 7,530 employees. That's counting everybody who's enrolled, every employee or retiree enrolled in the plan once for every month that they're active, right? Divide that number by 12 and you get your average contracts of about 626, right? And then I create a per capita. Box 2 just kind of gives you some information. It's my claimants over 50,000. You can see we're up to almost 9 compared to 7.2 on really just one additional member. For those claimants that went over 300,000 or would trend to be over 300,000, we're going to back out the 2.9, which is listed above. That's on 7 members. And actually, in the running 12 months, we had about $893,000 over stop loss, right? So if our stop loss policy ran through November 25, $893,000 would come back to the plan in excess claims, and that's on 4 members. And then you can see that add back number, right? And that's 2.1 million. So for all those 7 people, right, that 2.9 million I backed out on 7 people, I'm now going to add them back at 300,000. 300 times my 7 is the 2.1 million. Okay. Next box down, here's where we do the projection. And the first line is a very important one. It says trend months. Column 1 says 22. Column 2 says 21. That's the number of months I'm projecting forward, right? So I'm trying to make November 25 claims look like August 26 claims, right? In the insurance industry, we use annual trends. Well, I can't use an annual trend if I'm trying to predict out more than a year. So we use what we call an applied trend or an effective trend. Easiest way to think about that is if annual trend was 12%, you can assume trend is 1% a month. Then if I'm using a 21-month trend, my trend would be 21%, okay? It's not exactly how it works, but it's close enough. You could also just take my 10.96 You could divide that number by 12 and then multiply it by 21. It'd be the same thing. But there's really a formula behind it, but it would get you pretty close to that number. So we're going to take our per capita from box 1. So in the second column, it's a little over $2,000. I'm going to increase that by the applied trend. So right now for annual trends, we're using 11%. That's 11.5% for medical and 10.5% for drug right now. So again, like I said, it's the first time in many years that medical trends have been higher. So that blends out to be just a little bit under 11%. I'm somewhat optimistic that if claims kind of continue at this pace, if things still perform well, maybe we can look at adjusting trend a little bit. But this is where I fully expect the market to be. Both Anthem and Cigna are pretty consistent with their trend outlooks right now. So it's kind of where we'll be. But we could see some improvement in that number. One discussion piece we've been having with the carriers is that the hospital claim increases seem to have taken place over the last couple of years. Most of the contracting appears to be done for the most part. So then do we see some relaxation of those trends? I mean, not that they're going to go down, right? But maybe they don't need to go up as much as they were going. So that'll be something that might develop more over the year. So we're going to take the 2,000, we're going to increase it by 20%. That gets us at $2,400. We have a margin number here. Don't worry, we don't ever really add margin. When last time I added margin to a number was when the ACA passed and we were adding free preventive care and we were adding coverage for age 26. We really were struggling in the industry to know what's the impact of that going to be. So for a lot of our clients, we provided some margin in there, right? Here's what this might look like. And so we wanted to kind of account for that going forward. But it's a one where you might see us put margin in if, Brian said, hey, we're building a brand new school and we're going to have a bunch of new employees. We're not sure how many yet. We might make a margin adjustment, right? And we would do that in consultation with you guys. But I can't think of any time we've added margin besides with the Affordable Care Act. So I take my trended claims with margin. I'm going to multiply that by my current contracts at 625, project that number forward. That gets us to $18 million. But then I've got to add in the 2.1 for all those add backs. So that gets us to a claim projection of just over $20 million. You'll see I have two other adjustments. If we need to make other adjustments based on Cigna's providing me some data that maybe I want to make an adjustment for. I like my number to be there, and then I might agree with them or not, and I can still make adjustments, or there might be other reasons to make adjustments. So they're just there if we need to make them. But so basically, we're coming up with a claim projection of a little more than $20 million. Unfortunately, it got over 20. It'd been nice if that came in at $19,999,999, but it didn't. So it's about a 10.6% increase in claims. What you might have gathered from my long presentation so far, that's mostly being driven by trend, right? Plan's running pretty good. And I think really what's impacting us right now is that trend. So it's kind of why I said as the year goes on, if claims are performing well and I'm getting more optimistic data from the carriers, maybe we can come off that 11%, 10.96% trend a little bit in the future. Down below is where we add in the fees. The only fee that's really important here is stop loss. I mean, they're all important, but stop loss really drives the cost. Right now, we're using a 15% increase. Enrollment's down a little bit, right? 15% I was using. Yeah. So in total dollars, it's 14.63%. That takes our stop loss from 1.6 to 1.8. I'll be honest, I think that's a placeholder right now. I think that number can be much better if we continue to perform at the level we're performing. And we'll be working with the town to look at new vendors if we have to, if we can't get Sun Life to be a little bit more aggressive. So it is a placeholder. It's so early on. You can get $300,000 claimants next month, and then everything I just said goes out of the water, right out the window. So I think it's a reasonable placeholder. It's kind of consistent with what we refer to in the stop loss industry as leverage trend. So I feel comfortable with that number for right now, but I do think that's an item that we could see some improvement in. You have a TPA that does some services for you. That's a flat rate, basically at about $13,000. Hasn't changed in a long time. Admin fees, those are the fees that go to Cigna to pay for their services. That's, medical and dental. What you'll see, though, is a negative below that of $750,000. With our contract with Cigna, we get 100% of the drug rebates back. Last year's number was $750,000, so we're using the same number from last year. That number could be higher or lower. The good news is if that number comes in at, let's just say, $600,000 like it did last year, it doesn't mean that, oh no, there's $150,000 to fill in the budget. What it means is we had a lot more generic drugs, which means our drug costs would have come down. So I'd rather see our drug rebates be zero, meaning we used all generic drugs, than to get $750,000 in drug rebates. We're much better off using generic drugs than we are getting drug rebates. So we just add the total cost, the fixed cost to the claim cost. We get a total projected cost of $21.7 million on a per employee basis that per year. So per contract per year is PCPY. That's just under $35,000 on average per employee per year. It's about a 9.98% increase over your current budget. If some of these numbers look a little different, stop loss, Sean had to fill in the number we were using before we finalized stop loss, which is a little bit higher, 1.8, was it 1.8 that we had in there before in the current year? So that number will always be a little different. I use the actuals. So about 9.5% in total dollars, or about 1.8 million. No question.
Joe, thank you so much. Any questions for Joe? Brendan?
Thanks, Joe. Just a few questions. So first, do we have a sense as to why the total number of members have declined over time? I don't know if that's a question for Darlene or any idea?
I mean, all I can think of is that people are electing not to because a spouse has insurance coverage that might be better. Typically, that's the reason.
Okay.
It's fairly consistent in what I'm seeing in Connecticut in public sector. One of the things that could drive it too a little bit, and I don't know age-wise, but a lot of your new teachers are under age 26, and they're staying on their parents' plan.
That's right.
And so we've kind of seen this where it's a little hard to project. Like if you hired 20 teachers in 1 year that were all 23 years old, well, guess what? 3 years from now, you're going to see 20 new people on your health insurance plan.
Right.
But I think also, Brendan, what we're seeing is public sector plans are becoming more similar to private sector plans than they were in the past. So where in the past, if you were a married couple and employee A works for the Board of Ed and employee B works for a private company, you were taking the Board of Ed plan all day long, right? It was just a much better plan. Now what we're seeing is the plans are getting more and more similar. And so we are seeing that, people are opting out of our plans, the public sector plans, and taking private sector plans.
Okay. That's helpful. So just following on that, can you remind us where we are now on employee contribution percentages relative to maybe 5 years ago, roughly? And I know that it's in flux between.
Yeah, it's a little bit different for each group, but it tends to trend maybe a 1.5 or so every 3 years. Some years we'll freeze it, and then another one we might in a 3-year contract. They're all generally, I believe, at or about 20 to maybe 23% for the premium share, depending upon the group, and it varies a little bit in some of the groups for individual coverage versus family coverage and things. But we can put a chart together if that'd be helpful.
Okay.
Sure.
Yeah, I think it would be good.
Yeah, it'd be good to have for the budget conversation too.
Yep.
Sure.
And then last one, I don't remember the last 8 or 10 years trend being this high. So I just wanted to ask is that the case that it's the highest it's been in a really long time? And then is there anything more we can do from a plan design standpoint beyond just negotiating, contribution percentages that would help?
Yeah, the two important facts. So yes, trends are higher this year than they have been. I mean, they've been single digits, right, for the last 6 years. So drug trends have been double digits, but we've been, in the 8s, let's just say on average, on the medical trend. So that is a little bit alarming, and it jumped up a lot this year, right? It went from I think we were at like 9.2 last year we're using for medical, and it's, jumping up to 11.5. So it is, again, it's early on, so I can't put a lot of pressure on the carriers yet, but that is a number I want to pay attention to. But trends are higher. They seem to be consistent with what we're seeing nationally too. So it's not like it's just a Connecticut phenomenon from that piece of it. What was the second part of that?
Just plan design.
Oh, plan design.
Anything you think we can do?
Yeah, so I mean, a couple things that several things that we do, right, is we, in negotiations, we're looking at plan design, making sure the plan design is staying modern, right, against you're competing for employees, districts out there. What I would say is you guys are right at the kind of sweet spot with your deductible, and your plans are a little bit different in that you have co-insurance after the deductible. A lot of school districts don't. And so that's something that always comes up when we do negotiations is, hey, why do we have co-insurance when others don't? So I think you're kind of where the industry, the public sector kind of market can put you. The premium percentage, that's an easy one, right? You can negotiate those. Again, it's kind of dictated. What's interesting about public sector negotiations is you're heavily impacted by what your similarly situated districts are doing, right? Just like with wages, right? It's similar. So those are things that we can do to look at. But what's really interesting is, we could increase the deductibles and it would have an impact on the overall cost. It would mitigate trend a little bit. It would never absorb trend, right? Like I couldn't come up with an 11.5% saving. Well, I could, but it would never be accepted. What's really interesting to me is it's really those large claimants, right, that are driving our cost. So, I was talking to another group recently, and if you have $1 million claimant, it doesn't matter if your deductible is $2,250 or $10,000, right? It's still $1 million claimant. And so really it's kind of like, how do we maybe look at those large claimants and what can we do? That's a lot harder to do. One of the things that you guys do well, we're talking a little bit with Dr. Harrison about this, is New Canaan is a very active wellness committee. Every union's represented, every school is represented. And so you guys do a lot of things to kind of influence and encourage wellness. But at the end of the day, it's $1 million claimant might not be impacted by that. So the cost of claims drives a lot of that. Doesn't mean we should just give up and not try to make changes. But even if we did implement a higher deductible, overall, it's how's that going to really impact the large claimants, which drives most of our cost. So we wouldn't see a significant reduction, unfortunately.
Josh?
Thanks, Joe. I wanted to ask about the individual stop loss level that's stayed consistent at $300,000
Yes.
for the last 5 years at least, while
More,
premiums have gone up.
Yeah.
Is that a lever we could look at moving to impact premium prices going forward? Because again, if we're looking at $1 million claimants, there's only a handful of them. So that might be something we can move.
Yeah, so we can. So we're not locked into 300,000. I would say for a group your size, 300,000 is high. You're probably, I would say you're the highest group under 1,000 employees, right, that has a stop loss level that high. I mean, I'm sure I might be exaggerating. There might be one or two else out there. I've got a group with 1,000 employees who's at 500,000. They've been very lucky with their large claims. But yeah, that is something we can look at, is either up or down, changing stop loss. Here, you'd want to be a little careful increasing stop loss, just because of the reserve issues that you have, or not issues, the reserve policy and working within those arrangements. So if we raise stop loss to 400,000, let's say, that just puts more pressure on your reserve. So what we would typically recommend is, as you raise your stop loss attachment point, then you kind of rethink your reserve targets. And so if let's say you're targeting a 25% reserve, and you're going to go from 300,000 to 400,000, we might say, hey, do we want to maybe take that premium savings that you get by increasing your stop loss exposure and dump that into your reserve, right? So you're kind of paying yourself to take that exposure. Here, the formula is a little awkward with that, right? Because the town shares, in theory, a bigger portion of the reserve than you do. There's need, I think, if you need to get money from the town, there's a process for that. That might not be as easy as, oh, shoot, claims went over by, we got a $3 million claim, we need to pull money out of the reserve. But the answer to that question is yes. And it's actually a fairly easy analysis to do. What I kind of do when I look at that is I look at what's the total cost of large claims, right? So I say, what's my exposure in the large claimants that I have, right? So I look at who I know is on my plan. What am I paying in liability for them at $300,000? What's the stop loss premium cost? I add those two numbers together, that's the total cost of large claims. If I then say if I go to 400, I get a premium reduction, but I pick up additional liability, and we compare those numbers, right? So it's not real rocket science. It's pretty easy to do. And if you go backwards, right, if we lower stop loss, our premium goes up, but do we avoid liability? We have looked at that when we shop stop loss. We have looked at going down. I don't know that we've looked at going up in a while. We may have years ago, but we can always look at that. And it's not a hard exercise to do.
Great, thank you.
Yep.
Erica.
Thank you, Joe. Nice to see you again.
Nice to see you.
We've talked about it before, but the $50,000 threshold for the high dollar claimant, I'm
Yeah.
wondering, that has been consistent also for the last 5 years, and we know that costs are increasing. Keeping that number the same in some ways is apples to apples, but then when we see an increase in the number of members crossing that threshold, that is not necessarily as useful information in the context of just knowing costs are going up. So I was wondering, at what point would you advise reevaluating that, or does it not matter in terms of the usefulness of tracking?
I hear you, right? And I basically said it before, right? I think some of those $50,000 claimants were $35,000 claimants 3 years ago, right? So I'm just counting more people because things have gotten more expensive. I still think relatively the counts are low though, right? We're talking about 4% of your enrollment driving that cost. Which is still a pretty small portion overall of your enrollment. So I've been sticking at 50. It's interesting you asked that. I was in a meeting with Cigna recently, and they jumped from 50 to 75, and they said, hey, good news, your number of high dollar claimants went down. And I'm like, well, because you changed the threshold, right? But if I did ever do that, if we did ever decide to do that, I would make sure we change on all the columns, right? So that we're comparing apples to apples. But I've been staying at 50 for now. If we start to see that get into triple digits, or it's 10% of our enrollment, then I might want to change that. But for now, I've been kind of sticking with that.
That's helpful. And then I also wanted to, this is just echoing, you mentioned us going to market for the stop loss. And it seems like, I didn't do the calculations for every year, but it does seem like we are paying more for our insurance right now than, or at least this past year, than we got back in
Yes.
benefit.
Yeah.
What does it look like in translating that into a better, stop loss premium next year?
Yeah, so what we would generally say, right, if a stop loss vendor's, so we have a ratio called a loss ratio, right? And loss ratio, you take your claims over your premium. And so, for example, if we had $1 million in stop loss premiums and we had $1 million in losses, that would be a 1, right? So for every dollar in premium that Sun Life collected, they paid out $1. Generally, what I would say is I'm comfortable with the stop loss vendor making between 80 and 85 cents on the dollar, right? Because there's going to be a year where they lose. And so we need them to make money when they can, because we know there's going to be years where they lose. So they've been doing better than that. So I am, it's a little complicated because it's not just us, right? It's the town too. So any changes we make would likely involve both parties. And so there is some work that we're doing right now. I don't have the results yet of looking at, how is the town running, how are we running, and then how are we running as a combined pool. So more to come on that. It is some work that we're doing now.
Well, we're looking just at Board of Ed, but if our current plan is actually benefiting the town overall, then, if it's one side Board of Ed, but the other side for the town overall we're benefiting, then I would say we should stick with it. So I think
Right.
we have to look at holistically for what it costs the town and what the town gets as a benefit.
Yeah.
Combining it.
Yeah. So we're working on that with the town now to kind of get an overview of how we're running as a pool.
Yeah, and I hear your point that if we went back a couple years, there were years in which we were getting a lot more
Yes.
benefit than they were paying us a lot more than they were getting from us, and so
Yeah.
there is
You can see that
an
in the
ebb and a
first 2
flow
years,
to
right?
it.
Yeah, yeah.
So
But no,
I
it's-
understand. You can't expect to benefit every single year.
Right, and, but I mean, it's been, I think if you look at, from 2022 on, we're performing better than what our premium is indicating we should be.
Yeah.
One of the arguments stop-loss vendors make is, yeah, Joe, but you said it's not unlikely to get $1 million claimant. We get $1 million claimant tomorrow, and there goes our losses, right? But hey, that's part of the game, right? Like, we're not going to pay you all this additional money just because you might get we might get $1 million claimant. So
Yeah.
It will be an area. If I didn't stress it enough, it is an area that we're that'll be significant in our discussions going forward.
Yeah.
Unfortunately, we won't be able to lock that in though till late in your budget cycle.
And then on the final page, that block 2 where we were talking about the amount of cost, and it was the 2.9 for 7 members.
Yeah.
The amount we get benefit is the we get the difference between that and the 2.1, right?
Kind of. The only exception to that is the 2.9 includes some that aren't quite at 300, but would trend to be 300,000.
Okay.
But yeah, basically, right. And that, so you can see the actual excess in that period
Yeah.
was 893.
Yes. So, but that implies that, did we have any $1 million claimants? Because that, it sort of distributes to be in like
Yeah.
a $4,500,
Yeah, no, our last
$100,000 range.
year of $1 million claimant was
Yeah.
in
Oh, was that there? I didn't see
22,
that.
23.
Yeah.
At the bottom of the second
Yeah,
page.
sorry.
Yeah.
So even though theoretically we can always get $1 million claimant, we did not actually in the last.
Correct. Correct, yep. So one of the, what's interesting about the stop loss market is it's an easy policy to change, right? Because it has no member impact. So when a carrier takes some losses, you'll start to see them put some increases in, and then you start to perform a lot better. Then you just leave, right? So it's not like we stick with Cigna forever, right? Because it's just their overall fees aren't that much. Their network is good. We're our own insurance company. It's easy to change stop loss vendors. So you see a lot more movement in those plans. And it's easier for, if we shop this, go back to Voya, right? Voya could be a lot more aggressive because they don't have losses to make up, from the past. But I do, it'll be something important for us to focus on.
Yeah. Okay. Great. Thank you.
Yep.
Matt?
So, within the HDC, how many of the HDCs are net new each year, or how many of them are the same people year after year after year?
I can't tell you right now, but we could probably get
Not
back to you
exactly,
on that.
but roughly.
But I would say the vast majority are repeating. Okay, so maybe 80% are repeating. They're long-term, high-dollar claimants.
Got it. Okay. And just for my own knowledge, this is
Yeah.
not necessarily leading anywhere. So am I to understand if the 50, 60 or so people that are repeating account for 44-ish%, 40% of the cost, then those 50 to 60, 40 to 50 people, give or take, account for $8 million a year of New Canaan's insurance overhead?
Yes, if you look at the, on page 2, you can see 7.7 of that, right? So it would be a little less than that for last year if we assume 80% was repeating. 7.7 million of your total 17 was your high dollar claimants.
Okay. Sorry, repeat that one more time.
So if you look at, section 2, right,
Yep.
Second to last column, your total claims, right, your net claims were 17,654,000. Of that, 7.659
Yep.
was those high dollar claimants.
Okay. So $8 million.
Yeah, so about $7 million would be for claimants that we know are there, that kind of repeat every year.
Sure. Okay. Okay. Thank you.
Welcome.
Any other questions for Joe? Joe, thank you. This can be a tough meeting. We have 3 new board members, and I remember when you gave this meeting to me 4 years ago, and it was a lot to digest, but I think you do a terrific job taking a very complicated subject and simplifying it up for all of us, so appreciate it.
Thank you very much. Thanks. Take care.
Okay.
Thank you.
We're going to move on to the statement of accounts, and that's Sean.
Good evening. I'll start with the operating fund, the detail of which is on pages 3 through 8 in the package. Year-to-date through November, our expense actual is $38.7 million, or 34% of our full-year budget of $113.8. We also have another $69 million, or about 61% of our budget encumbered, mainly salaries and benefits and so on. Remaining unencumbered balance total $6.2 million, or 5.4% of the budget. Now, I mentioned that our attainment of our budget year-to-date November is 34%. That compares to 34.3% a year ago at the same time, indicating that we're spending slightly lower rate than we were a year ago, which is a good sign. It's one indicator, but it's a good sign. So still too early to conclude where we're going to land at the end of the year, but it's one positive indicator that we're headed in the right direction. For grants, pages 9 through 10, our total awarded grants, including prior year carryover, is $1.948 million. Year-to-date expended, $528,000, leaving a remaining balance of $1.4 million. In school lunch, on pages 11 through 12, our year-to-date revenue for school lunch is a little over $1 million, $1,000,093, which is 32% of our full-year budget. Year-to-year, we're growing $7,000, or 0.7%. Within that, sales are up $5K, or 0.6%. Catering is up $5K, which is an increase percentage of 23.6%. On the expense side, year-to-date November, $851,000, or 28% of our full-year budget, and a year-to-year increase of $4,000, or 0.5%. The increase in expenses driven by budgeted salaries and increases in beverage and dairy costs, and partly offset by lower groceries and paper goods. Our year-to-date net income in food services is $158,000, which brings our fund balance up to $818,000. In facility rentals, donations, and summer school, which are on pages 13 through 14, facility rental revenue is $54,000 year-to-date November, with expenses at $126,000. Net income is minus $72,000, leaving a remaining fund balance of $382,000. Donations revenue, $70,000 through November. Expenses, $83,000. Net income, negative $13,000, leaving a fund balance of $137,000. And finally, summer school revenue, $114,000. Expenses up the same, so we're breaking even through November, leaving a fund balance of $144,000. Questions?
Brendan?
So just a quick one. Are any of these fund balances items that we think we'll use elsewhere at the end of the year in our budget, or in next year's budget, I should say?
Yes, we could, especially if facilities fund balance. We have in the past taken revenue from facility rentals to use to improve, put curtains in an auditorium, seating, and so on. Yes, we have done that before, and we'll continue to do so.
Thanks.
Thank you, Sean.
Thank you.
Okay, moving on to action items, and there are several. The first of which would be the budget assumptions and related priorities, and then the budget calendar, the second read.
That's right. We shared these 2 weeks ago and then discussed them at our budget workshop. So they haven't changed since presented, and as you know, it's the document that starts to take our district goals and break them into actionable items that then are represented in the budget. So but we haven't heard anything about changes, so I think we're in good shape. We did have a small change on the budget calendar. We added a meeting with the Board of Finance on February 3rd. So our presentation to the Board of Finance will be February 3rd. But don't worry, if you've already booked the 24th, keep that one too. And we'll be able to get back there if need be to continue the conversation.
Okay, so with that, can I get a motion to approve as a second reading the budget assumptions and related priorities for fiscal year 2027 budget development as first moved and seconded by Ms. Schwedel and Ms. Kelly respectively? Josh, second.
No, just all in favor. Just a vote.
Oh, sorry about that. Okay, all in favor? It's unanimous, thank you. And then the second action item is the 2027-2028 district calendar, the second read.
Yep, no changes there since our first discussion. As you'll see, there's the Easter Monday is probably the change there, and as you'll also see, October does not have the as many days for holidays, et cetera, because they do fall on the weekends. So it's a great year for that addition in April. Beyond that, it's still our 182 customary days. It has 2 week-long breaks from January 1 to the end of the year, as the Board of Ed policy suggests us to do. And the last day is the middle of the second full week of June, which gives us plenty of time, if need be, to extend the school year, although we don't anticipate needing to do so without significant weather disruption.
Okay, so can I get a motion to approve as a second reading the 2027-2028 school district calendar?
Just vote to approve.
Oh, I'm making the same mistake twice. Okay, can I get a vote to approve?
All in favor?
Yep, all in favor. Thank you, it's unanimous. Okay, on to the committees. So first, we're going to talk about the Communications Committee and sunsetting that one.
Yes, so following the Board of Education bylaws, in order to make some changes on the committees, we sunset the ones that are no longer meeting or necessary or as relevant as they were. And then we also have motions to approve new ones that would take their place, et cetera. So with communications, we have our communications coordinator who's been doing her work for a number of years now. Communications will remain one of our district goals, and we will continue to be working towards those indicators and outcomes, of course. Doesn't reduce the importance of that work, but felt that prioritizing the committees with our board was very important in making sure that we're focusing on the things that matter most. We're not going to lose focus on communication, of course, but felt that it's something that we do regularly with the board, et cetera, and having a separate Board of Education committee for communication wasn't the highest leverage time spent. So we're going to sunset it.
Okay, so all in favor of voting to dissolve the BOE Communications Standing Committee? Oh, motion? Motion, Josh. Second, Hugo. All in favor? It's unanimous. Thank you. On to the sunsetting of the Resources Committee.
Yep, this one's a little bit different. We are actually, you'll see 2 down, we're going to be reconstituting the Facilities Committee. Resources Committee. What we're really looking to do is to put facilities and resources together into one. Because now that we've had a Facilities Committee for a year and a half or so, we've done quite a bit of research, pulled things together, and as we continue to approach the solution, whatever it may be, around the capacity needs and our enrollment, the town will be helping out and getting involved, and ultimately likely creating a municipal building committee. And we don't want redundancy in these committees. So to have the Facilities Committee as that primary, I keep saying facilities, to have the Resources Committee also doing the work of the Facilities Committee as we are talking about resources and the needs for enrollment, et cetera, makes good sense and was originally that way. And then we created the Facilities Committee to do that extra work, going on trips, visiting some sites, getting us to where we are now. And so to reincorporate that into the Resources Committee, again, is helping to focus our work and make sure that we are spending our time in the best possible ways. And again, we don't want that redundancy with the town as a municipal building committee.
Okay, so can I get a motion to dissolve the BOE Resources Standing Committee? Brendan, second. Matt, all in favor? It's unanimous. Thank you. On to the Facilities Committee.
Ditto.
Can I get a motion to dissolve the BOE Facilities Special Committee? Erica, second. Hugo, all in favor? Again, unanimous. Thank you. Fourth one out of five, the BOE Resources and Facilities Special Committee Charter, first reading of that.
And I'll only just say that it's a special committee because as a new committee, the first year it must be a special committee. And then if the board then takes action after its first year, it can become a standing committee for 3 years after that. But the bylaws are written such that any new committee becomes special in year one.
With that, can I get a motion to approve the creation of the BOE Resources and Facilities Special Committee and adopt its charter as a first reading? Erica, second. Laura, all in favor?
No vote.
Oh, no vote, sorry.
Yep. And we'll approve it. No vote.
This is like an obstacle course.
I know it is. I'm here to help.
Okay.
Yep. And
Fine.
it's a first reading. And then next meeting, if all agree, then we would vote to accept as the second.
Okay. Finally.
Can I ask?
Thank you.
Bill? Can I
Yes.
ask a question on this?
Of course.
So as we think about coordination with the town around, any facilities projects, how do we foresee that, or do you not yet?
So initially, it's short-term, and we'll be working with the town, the Board of Finance, and others to discuss how we'll resource the needs and the scenarios that we discussed at the workshop. And then once that hurdle is crossed, then we'll be probably first meeting with the Board of Selectmen to help them understand the needs for the school district. And simultaneously, we'll be working with architects in order to develop the educational specifications across all the buildings in order to help to inform some of those decisions.
Thanks.
Lastly, the BOE Curriculum Special Committee Charter, first reading of that.
Yes, so this is a new committee for us, and the thinking here and the idea here is that the Curriculum Committee of the Board of Education would meet regularly to work alongside district curriculum leadership with Dr. Krenti and other curriculum folks that we have across the district in order to receive reports and have input into the curriculum development work that's been going on, and to really look at the district goals around curriculum and be able to meet and discuss and share some of the progress made in those regards. And some of those will be some of the presentations that come to the Board of Education afterwards. So that would be folks that are doing this work and developing the curriculum, et cetera, coming to the Board of Education Curriculum Committee prior to then coming to the board as a whole. We see some of the items here, the deliverables. It'd be looking at things such as the high school program of studies, obviously textbooks, other things that are being discussed and considered to be incorporated into our program across the board, K-12.
Okay. Oh,
Sorry, looking at the scope and composition, I was wondering, I know on some of the facilities, there's cabinet members who sit in, on those, for instance, Sean is always there at the resource room.
Yep.
Is it appropriate, or is it within the bylaws to say that, I would say Dr. Krenti should be at these meetings if they are curriculum, to ask questions real time with those community members? Is that?
It wouldn't be in as a Board of Ed committee scope itself, but you're right, the resources, Sean's at that one, right?
Right.
So you're right, Dr. Krenti would be a participant in this, invited by the committee to attend.
Okay.
Yep.
okay. So can I get a motion to approve the creation of the BOE Curriculum Special Committee and adopt its charter as a first reading? Hugo. Second, Erica. No vote.
Nice.
Comments from the public? There is no public, so we're going to move on to announcements and future business.
Yes, our future business is to enjoy the holidays and to take some much-needed time to be with friends and family and enjoy the holidays and ringing in the new year. We have a long break this year because of the way things fall. We didn't think January 2nd, Friday, January 2nd, would be a particularly well-attended school day. So when we built the calendar, we wisely built that into the break. We are excited to enter into the holidays together. I do want to announce our New Canaan High School football team was victorious for the 4th consecutive state title on Friday on a pretty cold field up in New Britain, but they outperformed even our high expectations, but did it with skill and with class. And congratulations to Coach Marinelli and the entire group. The board was invited to join us on Friday morning. If you have not RSVP'd back to Sue Carroll, please do. And hopefully, if you are available, you can join us here at the Career Center to meet with our recent graduates from New Canaan High School, who will be sharing with us feedback about their first year in college, and we get to ask them lots of questions. It's a great morning if you can make it. And then, of course, they come into the Wagner Room and meet with the juniors and the seniors to talk to them about college and that transition, all those things. It's a wonderful thing that they do. Beyond that, we have January 5th to look forward to, where we will be unveiling the budget in its entirety. As you know, we spent our last meeting good 4+ hours going through the nuts and bolts of it a little bit on that object level. What are we talking about? What are our visions? And where are we going with it? Now we have some of the insurance feedback that we need. And then ultimately on January 5th, we get the whole package. So come with a book bag and you'll go home with a binder. Beyond that, I wish everybody a wonderful holiday and the happiest of New Year's. Thank you.
Terrific. Can I get a motion to adjourn? Josh, second. Kate, all in favor? Happy Hanukkah, Merry Christmas, and welcome again to Dr. Harrison to the board. See ya.